Hi, Dr. Edwina Coghlan here. This video is about your up-and-coming hysterectomy, which is likely being done minimally invasive, so that'll be through laparoscopy or through robotic techniques. So it's important to make sure that you realise you'll be staying in hospital for normally 1 or 2 nights after this procedure, depending on how the surgery went and if there was any increased duration of the surgery or increased pain. Sometimes you stay in an extra few nights. You won't be able to drive for the next 2 weeks at least after this operation until you can slam your foot on the brake, turn your head from left to right, and you're not on any strong painkillers. You're unable to drive. I encourage you though to get support for 6 to 8 weeks after the surgery so that you can recover physically and emotionally. I find that most women are at about 80% of their function after 2 weeks after a minimally invasive procedure, but as often they're busy with children to look after or other duties, if they don't take the full time to recover, they tend to not have best benefits from the surgery and have increased risk of perioperative infection and bleeding. I can give you a medical certificate for yourself and also a carer so that you can take time off to recover. In terms of common things to experience afterwards, so about 1 in 2 women will wake up with pain in the shoulder, and that's related to the gas that gets put in at time of surgery, and that will resolve over the coming few days, but it is quite uncomfortable and it's a really funny feeling. As the surgery is done through small incisions through your belly button and then other parts of the abdomen that are small incisions up to about 1 centimetre, you can have some bleeding and pain around those port sites in the coming few days. Doing this procedure tends to be very safe, but there is a risk when we put the ports in and also during the operation itself that we can damage surrounding structures like the bowel, bladder, ureter or a major vessel. That risk is probably around 1 in 2,000 to 1 in 8,000 when we look at all cases that are done internationally. There's also, I guess, the risk of my own experience, which I can talk to you about further. If anything like that happened, of course, I'd talk to you about it, but you tend to be at increased risk of operative complication if you've had lots of operations, things like cesarean section, or your weight is increased. You're also at more risk of having post-operative infection if you have increased BMI, but I'll have a chat to you about this. In terms of when you wake up, you'll have a catheter in the bladder. The next day, we will get you to make sure that you can pass urine, that you're eating and drinking well, and then we'll get you home in the preceding few days. I tend to have your results at about a week after surgery, and I'll give you a call about those. My nurse often checks in with you too. And then when I see you for your follow-up, I'll take you through how your surgery went once more and talk about the next steps in your journey to recovery. Hope you found this video useful. Please make sure you've read the written information that we've provided to you and also the handout from the College of Obstetrician Gynecologists on this procedure. And I'm happy to answer any further questions that you might have. Thanks a lot. Look forward to taking care of you.